Hi, welcome back to my channel. I hope you're all well, and today I'm going to be talking about hip dysplasia. So what it is, the different types, symptoms, how it's diagnosed and how it's treated. So hip dysplasia is a developmental deformity. It happens in utero. So the acetabulum is too shallow or incorrectly shaped, and consequently the femur is unstable in the hip socket. So this causes pain, limping and early arthritis, and it commonly takes 5 years of symptoms until the correct diagnosis is made if it's missed at childhood. So if it is identified at childhood, like early childhood when you're a baby, it can easily be corrected through bracing. However, it is missed quite commonly and then not picked up until late childhood, adolescence or adulthood, and at that point surgery is required to preserve the hip and correct the deformity so that life can continue as normal. So here's just an image showing a dysplastic hip versus a normal hip to give you an idea. And one of the major measurements that's taken is the lateral central edge measurement, and that's taken on a plain x-ray. And here you can see it measures from the center of the femoral head vertically straight up and then to the edge of the acetabula. So a normal measurement here is 25 to 40 degrees. Borderline hip dysplasia is 25 to 20 degrees, and then dysplasia is 20 degrees or less. And then another measurement that's taken from a plain x-ray is the acetabular index roof angle. So here they look at the medial weight-bearing structure of the pelvis, and they draw a horizontal line there and then an angled line to the top of the acetabulum. And here normal is 0 to 10 degrees, borderline is 10 to 15 degrees, and dysplasia is greater than 15 degrees. So you can see this is just, it's all showing that there isn't much acetabulum covering the femur. But these two measurements don't cover everything. So there can be anterior or posterior acetabular deficiency, which can't actually be seen in a standard plain x-ray, and you need more of a 3D image, so from like a CT scan, which shows slices from an axial perspective. And so lateral central edge angle and the acetabular index roof angle can actually be normal, but you may still have dysplasia in an anterior or posterior direction. So looking at anterior deficiency, this happens when the anterior wall covers less than 15% of the head of the posterior wall is deeper than the center of the head of femur and generally sort of over covers at the back. And then there might be anteversion of the acetabulum greater than 20 degrees. So you can see here on the left is the front on view, and you can just see through the different shadings the anterior wall and the posterior wall. And then on the right is an axial slice that you would get from a CT scan showing the acetabulum and the femur there with that angle of anteversion greater than 20 degrees. So you could see that the top being the anterior view, that the femur could just easily pop out the front there. So symptoms that you're likely to get here are anterior instability, so like subluxing out the front of the joint, and that's going to cause you anterior hip pain, and you might feel aggravated with extending your hips, so like at the back end of the walking or running gait, and externally rotating your hip like you would if you were crossing your legs. And this can just be, again, a developmental type of dysplasia, or it can actually come from excess trimming, surgical trimming of the anterior wall of the acetabulum done because of a femoral acetabular impingement. and not recognizing that there's actually dysplasia there. So something to be cautious of. And then there's posterior deficiency, which is where the posterior wall is shallower than the centre of the head of femur, and the posterior wall covers less than 36% of the head of femur, and generally the anterior wall is going to be over covered here. So you might have issues of anterior and posterior hip pain, like glute pain, and you might even have sort of neurological symptoms such as sciatic nervy sort of pain, and you'll generally have pain into hip flexion, so lifting the leg up or walking, and internal rotation, so that's when the foot is going outwards and the knees going inwards. You'll often find sort of like walking uphill or upstairs will be quite hard, and this is actually generally associated with a femoral acetabular impingement with like a pincer or a cam lesion on the femur or the hip. And you can see from the pictures here just the shading of what it might look like from the front, and from that axial slice that's taken from a CT. Often the acetabulum is actually retroverted. So the standard normal hip will have a very slight acetabular anteversion, but this posterior undercoverage will have acetabular retroversion. And then global deficiency is just sort of classic hip dysplasia, where you actually have reduced coverage anteriorly and posteriorly, and your lateral central edge angle is at least borderline, if not dysplastic, and your anterior head index is also in the dysplastic range. So you're really getting it all here. And because of that, you'll probably have like a diffuse sort of all over pain, weight bearing, all over the leg, hip area weight bearing, or doing activity, so even just standing, and you're going to get quite fatigued in your muscles with weight bearing, particularly the abductors, which are the sides, on the sides of your hips, the muscles there that really help to stabilize you, and also probably in your psoas muscles and adductors, which help to stabilize you too. So here's another picture just showing from the front on view, not much coverage, and then that axial slice. You can just really see there's nothing much holding onto the head of femur here, so it's really unstable. So treatment strategies for hip dysplasia, you really need surgery, unfortunately. And ideally, it's like surgeons like to do a hip preservation surgery, such as a periacetabular osteotomy. There are other osteotomy types, but the PAO is the preferred and most common type. And this is to prevent you getting further arthritis down the track. So if your hip is in, like the cartilage is in good shape, they will go for that. Generally that's up to the age of sort of 35, 40 that they'll still do that. Otherwise, if you've got a lot of arthritis, you have to go for a total hip replacement. Often you'll also have some labral tearing, because the labrum's that soft tissue structure inside the acetabulum that really helps to stabilize the hip as well. Now, if you've got hip dysplasia, your bones are not stabilizing you, so that labrum works a lot harder and is commonly torn. So that will also be repaired arthroscopically to give you some more stability. Now, it is contraindicated generally to do just a labral tear repair and not correct the dysplasia, as doing that labral tear actually requires cutting into a little bit of the acetabulum. So you're actually making the bony structure slightly less stable, and you're also not correcting the cause. So more than likely the person's just going to re-tear their labrum. And then with all of these procedures, either of these procedures, you are going to need to do lots of physio, because your muscles are your biggest stabilizing support. And these are really quite big surgeries, and sort of reconstructing your anatomy in a way it's never been before. So even though it's better, your body's got to readjust to that. So it really does take a lot of time and dedication and strengthening to recover from these surgeries, but it is essential to have a good result. So here I've just given you a little image of how a PAO works. So they cut around the acetabulum, rotate it to give you good head coverage, and then screw it into place. It takes about 8 to 12 weeks for the bone to heal, and for 8 weeks you will be using crutches to protect that. And you can see on the right is the picture of my PAO on the left hip. The prognosis after a PAO is very good. People are expected to make a full recovery and be able to return to normal life, basically, do sports and just general activity. So thanks for watching, and if you've got any questions about hip dysplasia, please don't hesitate to send me a message or comment on here, and I'm happy to answer. And thanks for following along with my journey and my channel, and please remember to like and subscribe so other people can see this too.